Good afternoon, everyone, and wish you all a very happy Women's Day. Today's session is in you with the topic that we have, that is Women's Day, and it's about women's health. So let's tune into the session to know more about facts about your PCOS, menopause, perimenopause, the impact of hormonal balance on various aspects of life, maybe some busting myths on hormonal replacement therapy, so on and so forth. To take over this session, we have with us Dr. Rubina Pandit, who is a gynecologist and an infertility expert. She has been one of the greatest names in the field of reproductive medicine. Her papers and poster presentations are shared at state and national level conferences. She has won several awards in her field of expertise. Without further ado, I hand over the session to Dr. Rubina, who will be taking care of this session. Thank you all for joining in.
Hello, everybody. First of all, happy Women's Day in advance. And without any delay, I'm going to start with the session. Just a quick request, in case if my voice is not audible or if there is any glitch in the network, I would request any one of you to please update me regarding the same.
Please go ahead.
So, women are the magic of the world. As we all know, that it is because of women that the entire world is running. So, first of all, happy International Women's Day. It is not even one day, 1 hour, 1 second, but I'm sure every day of every year is Women's Day because everyone's life run because we all are working, not only at home, at physically as well as mentally, emotionally, and so when you talk about women's health, so your health is important at every age. It is not after 40s or after 30s you start taking care of your health. Right from the period of adolescence till the period of menopause, every stage of women's health is very, very important, and you face so many challenges at every age which you should be aware about and you know how to tackle them. As it is rightly said, a woman's health is her capital. You are healthy, your entire family is healthy. Now, what is the objective of this talk? First of all, women's health is dynamic, and as I told you, that is evolves from adolescence to menopause. So, the objective of my talk is actually to provide you a holistic approach to understanding what all problems you can face in various phases of your life and how you should manage these problems. So basically, I want to empower women with the basic knowledge that is required for them to enhance their reproductive health and overall well-being. So why women's healthcare? As said by Michelle Obama, that communities and countries and ultimately the world are one as strong as the health of their women. So women physiologically also, if you talk about reproductive health, women physiologically need more healthcare and more access to the healthcare system compared to men. We are bound, unfortunately, to have more health issues as well as reproductive issues because of the hormonal imbalance. Women tend to have more hormonal related disorders compared to men. So you should be aware that what all problem is normal, what all problem needs intensive care from a specialist. So women have unique healthcare needs. So while part of this is due to your reproductive health needs, they have more health issues that are related to their gender. Like I told you, menstrual problems, the problem of polycystic ovarian syndrome, contraception, menopause, osteoporosis. So a female reproductive system actually consists of a uterus, fallopian tube, ovaries, cervix, and vagina. So everything is important, and problem in any of part can cause various health issues. Now these are the different stages of a woman's life. We are going to divide them into 4 different parameters: adolescence, fertile years, perimenopause, and menopause. Now, coming to the first and foremost is adolescence, which we know is a very, very labile period because the girls are bursting with hormones. So, what is adolescence? Adolescence comes from a Latin word, adolescere, which means to grow up. That means you are growing up, not even physiologically, you are growing up physically, you are growing up mentally, you are growing emotionally. So it is a transitional stage of physical and psychological human development, which generally occur between puberty and legal adulthood. Now, the period of adolescence is mostly closely associated with teenage years, although its physical, psychological, and cultural expressions can begin earlier and end later. Now, there are two stages of adolescence. One is early, one is mid. Now, early adolescence is basically 10 to 13 years, where females usually females undergo a growth spurt as well as development of secondary sexual characteristics, development of breast, and the start of menses. Now, mid-adolescence, that is 14 to 16 years, is primarily associated with more of psychological experiment. You know, they want independence, they want their own identity, they have little bit of anger issues, lot of mood problems, they want to experiment with peers, and obviously attraction towards opposite sex. Now, what are the common problems in adolescence? The most common problem in India per se is menstrual disorders, primarily associated with polycystic ovarian syndrome. Then substance abuse, drugs, alcohol, anabolic steroids, and drugs. Now, it has now become a greater problem in adolescence. One thing is because of the increased access to social media. It is, on one hand, it is good that everyone, you know, you want to go to gym, you want to maintain their body, but sometimes in this rat race of looking good and having better physical body, they start indulging into the substance abuse, they start indulging into unnecessary medications, as well as nutritional disorders like bulimia and anorexia nervosa. Then behavior problems, obviously anger issues, mood swings are quite common among adolescents, mental health, depression, then acne, hirsutism, all are associated with polycystic ovarian syndrome. Ovarian cancers, there are very specific ovarian cancer like germ cell tumor, which are more seen in teenage girls, but it is very down the list. And major problems are mainly menstrual disorders and the behavioral issues. Now, do we need to do any specific test? So all the tests are basically general blood investigations like knowing your blood group, your basic hemoglobin. In case patients are having excessive bleeding, they might have anemia. So to just check one hemoglobin to make sure that they are not having low HB, you should do one CBC. Thyroid, specifically patient have unusual history of increased weight gain or too much of lethargy and too much of tiredness, then you should must get their thyroid test done. Rubella, that is a general thing which we do, a random blood sugar and a basic ultrasound scan to rule out polycystic ovarian disease. Now, counseling in this age group, the most important counseling is about menstrual hygiene and practices. Cervical cancer vaccine, I am actually very happy that people are now getting aware regarding this, and we are getting a lot of queries about cervical cancer vaccine, and the incidence of patients or the number of patients taking this vaccine has really increased. Contraception, mental health counseling, I will also add sexual counseling is very, very important in this age group, as well as counseling about menstrual disorders like PCOD. Now, coming to the menstrual practices and hygiene. Now, we know we have two types of menstrual hygiene. One is the use of menstrual pads, which we have been using for ages, and the second is use of menstrual cups. Now, if you talk about menstrual cup, it is reusable. It is much more environmental friendly. You can continue it on daily. You can use one cup throughout the cycle as well. It is you can continue doing your all daily activities. But the problem with menstrual cup is the initiation. So basically the patient or the girls, they are little skeptic about using it. They don't know how to use it. So whenever anyone wants to use a menstrual cup, it is always advisable that they should just meet one gynecologist. The gynecologist at least can guide you regarding what size you should be using, whether you should use an S size or XS size. And the second thing is how to insert it properly. Because of these two skeptical reasons, girls are very, very skeptic to use menstrual cup. But once they get used to it, I can tell you that it is much more easier to use compared to the pad. And the usage wise also, it is very, very easy to clean them. You get special wipes for you cleaning of these menstrual cups. Otherwise, you can just keep them in a boiling water, or just first wash it with a normal water, but do not use the normal soaps. There are special soaps which come to clean these menstrual cups, and after cleaning them with regular tap water, you can keep it in a boiling water for about half an hour, then again reuse it. So the only problem which I have felt with menstrual cup is they are scared to use it, because just looking at the size, they feel, oh, how are they going to insert it? But trust me, once you go to a gynecologist, once she explains you a proper way and she tells you the exact size, it is much, much easier and it is very eco-friendly. The second thing is use of cervical cancer vaccine. Now, cervical cancer is mainly caused by a virus called human papilloma virus. Usually, it is recommended in 3 doses, which is at 0, then 1 month, and then 6 months. And the immunity lasts for as good as 20 years. Now, the best time to give this vaccine is as soon as the child attains menarche. When you give the vaccine in the age of 11 to 13 years, and it can be given as early as 9 years as well, but the recommended age is 11 to 13 years. That is when you have the maximum benefit. But it can be taken up to 42 to 46 years of age as well. But the later you take, the lesser is the efficiency. Emergency contraception, again, this is a part of sexual education which needs to be given to adolescents, which is very, very important in case they are indulged in unprotected intercourse. The morning after pill, which is made of high dose of estrogen and progesterone, it prevents implantation of formed embryo and prevents pregnancy. It should not be used as a routine contraception. It should only be used in cases of emergencies like rape or condom failure. But it is very important to educate these youngsters regarding healthy contraceptive practices. Now coming to the next stage of female life, that is fertile years. So in fertile years, which is from 18 to 38 years, the most common problems which we all encounter is menstrual disorders, primarily PCOD, endometriosis, thyroid, sexual disorders. Some patients after marriage have a lot of pain during intercourse, severe vaginismus, which can be medical as well as psychological, problem of infertility, which is on the rise because of multiple reasons, maybe because of our lifestyle, as well as late marriages, late family planning. Mental health, we all know that female in the rat race of managing both work as well as personal life, they sometimes take too much of stress on themselves and do not take care of their mental health, which is as important as physical, and the risk of various cancers like ovarian and cervical, which needs frequent monitoring as well as screening. So polycystic ovarian syndrome, it is one of the most common female endocrine disorder. So if I have to just tell you in a brief what is PCOD, basically PCOD, the underlying problem is increased androgen and insulin resistance. So these are the two problems because of which the patient has or the patient develops symptoms of PCOD. Now, one thing is that not all PCOD patients will have symptoms. So there are certain patients who have absolutely normal menses, they have kids, they have no acne. It is only on a regular checkup where they find to have a PCOD. Do you do anything about it? The answer is no. A PCOD is treated only if patient is presenting with the symptoms, which I will be discussing in the later slides. One more thing is that there is a strong evidence that it can be large degree classified as genetic disease. So maybe your mothers or sisters, they don't have per se PCOD. See, one thing is obviously our mothers and grandmothers, they never got themselves evaluated and they never had any problem because their family would be completed by 21, 22 years of age. But they will definitely have some hormonal condition. Either they will have history of fibroid, they will have history of excessive bleeding, they might have history of endometriosis, but some hormonal disorder will be there. So I'm not telling all PCOD is genetic, but there is a very strong history of genetic predisposition. Now, as I told you, PCOD per se produce symptoms in only 5 to 10% of women of reproductive age. That means rest 90% they don't have symptoms, out of which 80% do not even know till the end of their reproductive age that they have PCOD. But those who have symptoms, it is one of the leading cause of female infertility and the most frequent endocrine problem in women with reproductive age. Now, what are the symptoms? The first is irregular menses. So usually irregular menses, either females will not have menses at 30 days, they will have at 45 days, they will have at 60 days, or some patients, depending on the severity of PCOD, they do not have any bleeding unless they take a withdrawal medication. So it depends on the severity. If it is a mild case, the patient will have 10 or 20 days late period, probably not a 30-day cycle, it will be a 45-day cycle. But if it is a severe case, then the same patient might not get period up to 3 years, 3 months, 4 months. And as I told you, the most severe case, they will not get periods until unless we give them withdrawal medication. And excess amount of androgen hormones will result in acne, hirsutism. There will be more facial hair growth, there will be blackening of the skin, and there will be outspurts of acne. And again, PCOD is associated with increased risk of obesity, diabetes, as well as high cholesterol level. So it is basically a vicious circle. Obesity increases PCOD, PCOD will lead to obesity, and obesity again will lead to other problems. So you have to break the circle. What is the management of PCOD? As I told you, the most important for any patient is weight reduction. So even if you are thin, you are only 45-50 kg, but you have PCOD, you have irregular menses, still lifestyle modification in the form of exercise, weight training is very, very important. I don't recommend a 50 kg woman to go and become 40. They don't even lose 1 gram, that is perfectly fine. So the main important thing is they will have more visceral fat. What is visceral fat? The fat which is present around your organs. So even if you are a lean PCOD, your internal fat is more, which is causing insulin resistance. So you need to indulge in more weight training, not to reduce weight, but to reduce that visceral fat, which in turn will help in improving your hormonal imbalance. The second is treating the period irregularity. Now, period irregularity, again, first, the main thing is those who are obese or those who are not doing any weight training, we tell them to do some lifestyle modification and then wait for 3 months. If after, despite doing everything, they are still not getting their periods regularly, then we give some medications in the form of insulin sensitizers or hormonal medications to regularize their period. Treating the acne and hirsutism, again, it is with respect to your hormonal imbalance. You can have topical ointments to treat that. Correcting the insulin resistance with the help of insulin sensitizer like minoxidil as well as metformin. And finally, the patients who have infertility with PCOD, they need to meet a fertility specialist who will guide them how to go about it in planning pregnancy. Managing weight. So what is the benefit of losing weight? Again, as I told you, there is a lower risk of insulin resistance because you will reduce your visceral fat. So there is a lower risk of developing diabetes. There is a lower risk of developing heart problems. There is a lower risk of developing uterine cancer, that is your womb cancer. You will have more regular periods. You will you have an increased chance of becoming pregnant, a reduction in acne, decrease in your excessive hair growth. You will have improved mood and self-esteem. So you only have to lose a small amount of weight to make a difference to your symptoms or your health. If medically, I have to tell you, even if you end up losing 5 to 10% of your weight, it will show effect. Contraception, there are different types of contraceptions: oral contraception, barrier contraception, IUCD, progesterone, tubal ligation, morning after pill. So oral contraceptives, again, it is associated with some side effects, so it is not recommended beyond 3 to 6 months. Someone who is not planning pregnancy, barrier contraception, that is use of condoms, as well as IUCD is much more effective. Those who have completed the family and they do not want to plan any child, tubal ligation is a permanent solution, but for this, that is only recommended when your kids are at least more than 5 or 6 years. And morning after pill should only be taken in emergency cases where your barrier contraception has failed, or once in a while, but it should not be taken on regular basis. Coming to infertility. Now, infertility is basically defined as inability to conceive after 1 year of unprotected intercourse to carry a pregnancy to full term. So when do we start investigating? Usually we say after 1 year of unprotected intercourse, but this 1 year will become 6 months if you are more than 35 years of age, or you are married, or you have other comorbidities like your periods are not regular, where you are having problem in sexual intercourse, or any other medical condition that can affect your chances of conceiving. You should not wait for 1 year. You can probably go and get yourself at least investigated by a fertility specialist. So if I have to talk about basic investigation, see, there are multiple investigations which are mentioned in the file or in this PPT, but if I have to just advise you two, I will just advise you two. That is, one is anti-Mullerian hormone and second is semen analysis. These two are very, very important. And me being a fertility specialist myself, I am seeing females, young girls coming with very, very low AMH. So what is AMH? AMH is a test which tells you about the number of eggs a female has. See, the basic difference between male and female is male, they produce sperms on regular basis. Females, they are born with a certain stock of eggs, and as you are aging, your egg count will reduce, and there is no medication to increase this AMH. So the normal value of AMH should be in the range of 2.5 to 4. So if your AMH is less than 2, that is the time where you need to meet a fertility specialist and get yourself evaluated and plan your pregnancy as soon as possible. So that is one test. Now, is there any symptom or is there any sign with which you can see, okay, whether your AMH is good or bad? Very, very subtle sign is patient who have short cycles. So if any patient who has a cycle of 24, 25 days or 26 days, these are the patients where usually AMH is on the lower side. I'm not telling that all patients who have a 26-day cycle have low AMH, but if I have to go reverse, when you check an AMH and then you go back and ask them how's your cycle length, usually at least 50 to 60% of them will give a history that doctor, my cycles are only 25 days, 26 days. So if you have a cycle of 25 or 26 days, it is very, very important that you just get your AMH level, because if that is very, very low, even as fertility specialist, despite giving you IVF, the chances of pregnancy becomes very low. The second thing is semen analysis. Semen analysis for the partner, where they will check count, motility, and morphology. Make sure that one semen analysis, it has to be done by an andrologist, not by a lab technician, not in a usual lab. Just get it, that these two tests, you can get it done whenever any patient who is planning pregnancy. If all the reports are okay, we as fertility specialists are going to tell you, see, everything is fine, do not take stress, just try naturally for 6 to 8 months. If you are not able to conceive, we are there to help. And advanced testing is, again, if basic things are not working, I'm not going to discuss all these things. For me, the basic take-home message with respect to infertility or any patient who is planning pregnancy is get an AMH done and semen analysis. Management of infertility, as I told you, there are multiple management: ovulation induction, IUI, IVF, third-party reproduction. So that your doctor or fertility specialist will be there to guide you, and that is, the decision is mainly taken with respect to age of the patient, married life, and your AMH and semen analysis. Third-party reproduction, as I told you, for patients where AMH is very, very low, unfortunately, we don't have much treatment options for them. If the AMH is less than 0.4, 0.3, the chances of them conceiving with their own eggs is hardly 5 to 10%. So if they are not able to conceive with their own eggs, those are the patients who have to go for third-party reproduction. Oocyte cryopreservation. So initially, egg freezing was recommended for medical reasons. That is, the patient, primarily for patients who are diagnosed with cancers and they are going to undergo a chemotherapy or radiotherapy, which can result in reduction in their eggs. Those are the patients who used to come to us for egg freezing. But now, because of the increased awareness, our 70% of the patients who come for egg freezing are social reasons. Now, what is the social reason? Because they are 30, they are still not married, and they are not planning to get married for another 5 years. These are the patients who will come and freeze their eggs. So once you freeze their eggs, even if you get married at the age of 40, but if you have frozen your eggs at the age of 30, the success rate of you conceiving with your own gamete is very, very high. Rather, now the awareness has increased so much that we get patients at 25 coming and freezing their eggs. So social egg freezing, because of the increased awareness among the patient, is on the rise. And any patient who is now 30 and still not married, or probably 28, 30, not married, just get your AMH done. If your AMH is on the lesser side, just freeze your eggs, because in general, once you will become 35, 36, the chances of you conceiving with other treatment modalities also reduces drastically. Okay, I'm not going to discuss. Yes, so for in your fertile period, the yearly checkup mandatory. See, pap smear LBC is recommended every 3 years, or if you're doing HPV testing, then co-testing is recommended every 5 years. But pap smear is very, very important to be done every 3 years. Then the second most important is self breast examination. So this is one thing which I wonder why patients are not aware of it. So you should always keep one date every month where you should do a self breast examination. And when you're doing a self breast examination, it is usually recommended when you are probably taking a bath or any particular time, but you should first examine your breast. Stand in front of the mirror and first examine your breast and see whether they are in same in size or not. Then you start palpating it. So when you palpate it, you first have to palpate it in clockwise manner, then anti-clockwise manner, then up to down, and then right to left. So like this, you need to palpate it and see whether you are feeling any mass or anything. If you are feeling any mass or any lump, immediately go to a general surgeon or a breast specialist. Then the third area which needs to be checked is your nipple area. You press the nipple area. If there is any milky discharge or anything coming, again, which is not normal, so you need to meet a general surgeon. And the third thing in breast examination is examination of your axilla. Again, sometimes you find a lump in the axilla which is not present in the breast. So if you are finding any swelling in your axilla region also, that also should be taken seriously. Along with it, thyroid disorders, hypertension, diabetes, ultrasonography, colonoscopy, I will not recommend on regular basis if you don't have any digestive problems. But sonography, again, once in every year or once in 3 years, you should get it done. So what can you do to protect your reproductive health? Again, have a healthy lifestyle. So you should eat your meals on a very regular basis, especially breakfast. You should exercise regularly, 30 to 45 minutes at least 3 times a week. See, now there is one trend which is going on, which is, intermittent fasting, which is shown to have lots and lots of health benefits. But if you see your ancestors, if you talk to your grannies, you talk to your grandmothers, none of us, even my grandmother, she does not eat after 7 o'clock and she gets up at 5 and eat. So this is what in the new term we call it intermittent fasting, which our ancestors have been doing since ages. They used to do all their household work. Somewhere their physical activity was so high that the risk of heart disease, cancers was much less. So you should maintain a healthy, balanced diet. And one more thing which people don't know about in diet is the efficiency and the benefit of millets. Millets is something, India is the largest producer of millets and still majority of it is exported outside. We ourselves staying in India do not understand and do not know the advantage of eating millets, micro millets, which has a huge benefit with respect to oxidative stress. Again, having good amount of omega fatty acid will reduce your inflammation in the body, and that will help you to have a reduced risk of heart attack, cancers, diabetes, and any other health condition. The next is perimenopausal, which is also called menopausal transition. So it is the interval in which a woman's body makes a natural shift from more or less regular cycles of ovulation and menstruation towards irregular cycles, permanent infertility, or menopause. So basically, it is a transition where you are ending up your fertility period. So basically, perimenopause is practically the end of your fertile period. So the years of declining fertility to the complete cessation of menstrual function is described as perimenopausal. It can extend for any period. It can extend from 1 year to 5 years. That means that is the time when your ovaries are producing less eggs, as a result of which it is producing less estrogen, and that is responsible for many symptoms. So the signs and symptoms of perimenopause and menopause are more or less the same: hot flushes, breast tenderness, worsening of premenstrual syndrome, decreased libido, fatigue, irregular periods, or sometimes when you are getting periods, you are getting too heavy periods, vaginal dryness, sometimes urinary urgency, urinary leakage, lots of mood swings, and even insomnia. You're not able to get a sound sleep. Now, what is menopause? Menopause is defined as the time when there has been no menses for 12 consecutive months. That is, for 1 year, there is no menses. So that practically marks the end of your fertility, the end of your childbearing age. But most important, there should not be any other associated biological or physiological cause. So it typically occurs in females in midlife during their late 40s or early 50s, and it signals the end of the fertile phase of a woman's life. So menopause is more accurately defined as the permanent cessation of the primary function of the ovaries. As I told you, the signs and symptoms of perimenopausal and menopausal are more or less the same. hot flushes, palpitations, night sweats. Again, there is an increased risk of uterine cancer and ovarian cancer, vaginal changes, thinning of hair loss, recurrent urinary infection, lack of sleep, bone loss, bone pain and fractures, depression, and weight gain. See, two things which I want to make very, very clear is after menopause, any sort of bleeding should not be taken lightly. Once you have attained menopause, after that, even if you see one drop of blood or a little bit of bleeding also, you immediately need to go and meet your gynecologist, get one pap smear done, get one scanning done along with an endometrial biopsy to rule out the risk of cancer. The second thing is every patient who attain menopause, there is a very increased risk of bone loss and there is a depletion of calcium in your body. So you should supplement your diet as well as your food with medications which include vitamin D as well as calcium. So these are the two take-home messages for menopausal females. Again, routine investigations are very important. You should get an entire investigation, your CBC, hemoglobin, fasting and postprandial blood sugar level, your liver function test, lipid profile, thyroid profile, vitamin D3 and vitamin B12, kidney, renal function test, ultrasound of the abdomen, as well as ultrasound of your uterus, pap smear every 3 years, and ultrasound of the breast. So basically, if you are less than 40 years of age, ultrasound of the breast should be done. After 40 years of age, you should do a mammogram. If there is no family history of any cancer, you should do it every 3 years. If there is a family history of breast cancer, cervical cancer, or uterine cancer, ultrasound, pap smear, and mammogram should be done on yearly basis. Again, management, counseling, reassurance is very important. As I told you, vitamin and calcium supplementation to prevent bone loss, exercise, treating a specific symptoms. If hot flushes are causing too much of symptom, you need to go and meet your gynecologist and take adequate medications in the form of hormonal sub pills or vaginal dryness. They will give you some ointment to apply on the vaginal to provide lubrication. Surgery if there is too much of that is in perimenopausal problem, and hormone replacement therapy is only given or indicated in cases where the hot flushes or any other symptoms are actually interfering with your quality of life. So to conclude, routine gynec checkup, who needs it? Me, you, and all women we know. How often to start? Start with one baseline checkup in adolescence. Cervical cancer vaccine is very, very important, and it is best efficacious when it is given at 11 to 13 years of age. Premarital counseling. You should know if anyone who's planning a pregnancy, you should do an AMH test to know your egg reserve, especially if you have short cycles. And in general, just get your routine gynec checkup done once yearly throughout your life. So the take home message, the 7 tips which I would like to give is exercise on daily basis, avoid substance abuse, avoid excessive alcohol and smoking, eat a healthy balanced diet, practice any relaxation method, be it yoga, be it Reiki. I will say drink at least 3 liters of water on every day, and health checkup on yearly basis to pick up any ailment at an early stage. So thank you and have a very nice day.
Thank you. Thank you, Dr. Rubina, for a wonderful session. We will go ahead with the Q&A. I have few questions lined up here. I'll be taking them one by one. I also request the audience to share their questions if they have anything related to the topic.
Sure.
Yeah. So there's one question that's asked that what is the typical duration of healthy menstrual flow and duration? Some women experience it for only 3 days, while some will have for more than 5. So is there a healthy flow and duration that?
Yeah, see, usually a good menstrual flow should last for 3 to 7 days, or to be precise, 3 to 5 days, but up to 7 days is also considered normal. When you talk about the flow, how much flow is normal? So we say in terms of pads, you should be using at least 2 to 3 pads in a day. But if a patient is using only one pad or they are just changing 2 pads just for the for their hygiene purpose, then that is a less flow, and that needs to be evaluated specifically for your egg reserve. So 3 to 7 days is considered as a normal menstrual flow.
Okay, okay, understood. There's also one more question. At what age does perimenopause start usually?
See, it depends on female to female, but in general, the perimenopausal period can start anytime from 45 to 50 years of age. So the usual age of menopause in India is 51 years plus minus 2 years. So, and the perimenopausal starts from 3 to 4 years before that. So around 45 to 47 years is the usual perimenopausal age in India. But as I told you, now I don't know whether it is the lifestyle, it is the stress factor, anxiety, everything is added up, because we are seeing a lot of females with low egg reserve. So those are the females who are going to attain menopause also early. And then they will have perimenopausal at the age of early 40s as well. But the usual standard age is 45 to 47.
Okay, okay. What is the healthy way to balance the hormones? Diet, exercise, any other?
Every see everything. It is a wholesome process. It is not, see, female body, you have to understand, it is very sensitive to changes. And the first thing which gets affected is your period. You change a job, your periods will be delayed. You are shifting to a new house, your periods will be delayed. You are not sleeping properly for a few days, your periods will get affected. So it is a wholesome procedure. But if you'll ask me, diet, one thing. Second is your sleeping pattern, your stress, anxiety, again exercise. These are the four most important factors which are going to affect your menstrual cycles and hormonal disorders.
Okay, okay. Um, our next question is, what are the pros and cons of hormonal replacement therapy?
It depends on age, right? So the hormone replay,
Right.
if you're talking about menopause, yes, so hormone replacement therapy has its own side effects, like you patient might have weight gain problem, they will have a lot of mood swings, they will have headache, they will have breast tenderness, they might have bloating sensation. So there are multiple side effects, and it also depends on till what duration you are taking. So if hormone replacement is taken only for 3 months, it usually does not add up to many side effects. But if you're taking it for a longer period of time, say beyond 6 months or 1 year, then that is when the side effects start coming up. And again, hormone replacement therapy, very mild risk, increased risk of heart disease or heart attack with estrogen therapy. Progesterone does not really cause increased risk of heart attack. But that is why I told you that hormone replacement therapy is only given in severe cases where whatever you do, the patient is not able to control her hot flushes, that the quality of life is getting affected. That is the only indication where we have to give hormonal replacement therapy. But usually when we give also, we give at a very low dose. So those low dose usually does not cause much of the side effects.
Okay, okay, understood. There are two other questions. I'll merge it, both of them. So there's a question that says, is there any other vaccine other than cervical cancer vaccine that women should look out for, especially women between the age of 25 to 45? And there's
Rubella
one more
vaccine.
question, similar, yeah, similar
So
question
one
which asks, is the
vaccination.
cervical, sorry, doctor. Okay, please go
Yeah,
ahead
yeah,
with that.
please.
Then I'll ask.
No, no, it's
Yeah.
okay, it's okay. You asked the second question
So
also.
yeah, the next question is also similar. So can we have a cervical vaccine after the age of 40? The effectiveness, basically.
As I told you, see, answering your first question, along with cervical cancer vaccine, the other vaccine which is now recommended for females is rubella vaccine. So someone who's planning pregnancy, they get the rubella IgG levels checked. If the rubella IgG levels are normal, no need for any vaccination. But if the rubella IgG levels are low, then they are given vaccination, and after vaccination, they should avoid conceiving for at least 3 to 6 months. That is one thing. Second thing is,
Okay.
yes, cervical cancer vaccine can be given up to 45 years of age, but how effective it is in preventing cervical cancer, it is little bit of a question mark. So if it is given in the teenagers, the efficacy is as good as 90%. But as you are delaying it, the efficacy reduces to almost 50-40%.
Okay. Okay. Yeah, I think that are the questions that we had. Most of the questions are similar to what we've already asked. I think that's about it that we have for today's session. Thank you very much for joining in, Dr. Rubina, for taking
My
out
pleasure.
time and giving us inputs on such important and valuable topic on women's health. Thank you all, the audience who have joined in, and a very happy Women's Day to all again, once again. Stay fit,
Happy
stay
Women's Day
healthy.
to everyone. Yes, yes, and take care of yourself first and then family.
Yes, yes. Thank you.
Thank
Thank you
you.
very much, Doctor.